Okay, continuing with question number 6 through 10. What might you do if a caregiver abuses a patient's rights, and how may you approach them?
Since I work in pediatric, this question can be quite difficult. A lot of the times, the parent is the caregiver, and since the child is under 18, it could be difficult regarding patients' rights. But I have been faced with this situation. A lot of the times, we deal with parents who have neglected their children or who have abused their children, and you can tell in that child, a sense of distress that they want you to talk to them, but without their parent, being in the room. A lot of the times what I do is I, ask the parent to step out of the room if the patient wants me to. I have another healthcare provider come into the room with me, and then we go over with the patient, what's going on at home. If I feel that the patient is, being threatened or is under distress, I call CPS if I feel that it is needed. Another issue that we face regarding patients' rights is, when the patient doesn't want the siblings in the room. Sometimes the patient goes in and the siblings are in there. If the patient does not feel comfortable and the parent, still wants all of them in there, I always ensure that the other family members are out of the room so the patient can feel comfortable. It's difficult in pediatric because the parents have the right to know everything about their child, especially if the child is a minor. A lot of the issues we face are, for instance, birth control. A lot of the parents don't believe that the child should have birth control, but the child would like, or the teenager would like birth control, just to ensure, that she will not get pregnant. At this point, I do not get involved because I do not, want to cause conflict, but I do let the parent know the pros and cons about, using contraceptives, and the good thing about avoiding teenage pregnancy at such a young age.
Okay. What might you do if a healthcare professional abuses a patient's rights, and how may you approach them?
I have definitely, had to take care of this issue in the past. A lot of the times you'll hear some other staff member, talking about the patient in front of other patients. What I do at this point is I always ensure to notify that healthcare professional that they are violating HIPAA, and that they should not talk about a patient's diagnosis. A lot of the times, especially dealing with teenage pregnancy, I can hear them whispering, so and so is pregnant. I always call it to their attention, and I do always let the practice manager know. If this continues to happen, and the practice managers does not do anything about it, I definitely bring it up to human resources, because I think that this is very important. Even though, we're a small facility and we may think that others do not hear us, it is important that as healthcare professionals, we follow these rules and laws. Just because we want to talk about a patient, we should not do that. We need to abide by all rules and laws regarding the patient's rights. It's difficult to hear one of your coworkers, and it's difficult to address them, but it is always important that as a healthcare professional, you address it in a manner that is correct, not to cause conflict or not to create any, conflict whatsoever. But it is important to bring it up to them, because we have to, follow HIPAA law, and we have to abide by it, and patients' privacy is very important.
Okay. If you feel that another provider has neglected the patient, what do you do, and how do you take care of this?
The way that I normally take care of this is, if I don't agree with the way another provider, cares for one of our patients, I usually address it with first another provider besides that one. I explain to them the situation, I explain to them how I feel, and then the other provider gives me their insight on what they feel is, good for the patient. If they explain to me that they feel that the provider is doing the right thing, and then my I feel better, I just let go of the fact. But if we both feel that the patient, is not being cared for correctly for that provider, what we go ahead and do is we talk to the provider and let him know what our issues are and how we feel about how he has taken care of this patient. If he doesn't continue, we definitely ask for a second opinion if we don't feel that the provider is correct.
Okay, what do you do when you feel that you cannot provide the patient with the same care due to lack knowledge in that field?
When I feel that I cannot, take care of the patient, I definitely refer them out to a specialty clinic just to ensure that they are provided the care that they need. Once they are seen by the specialist, I review their notes with them to see that everything is going great.